Tima Philippines reached a milestone last month when they organized their 100th free clinic. Since the first event in 1995, when operations were carried out on school desks, to the certification of a new clinical center last year, Tzu Chi's free medical services have come a long way.
August 22nd is the birthday of the first Tima member in the Philippines, Liu Xiuquan. 75 years old today, doctors from Chinese General Hospital in Manila are celebrating with him.
My wish is to keep working for Tzu Chi. There have already been 100 free clinics. I'll keep going until number 200.
Happy birthday!
Sitting in a wheelchair and not as healthy as he used to be, Liu Xiuquan is willing to give his last gasp to Tzu Chi. From the first to the 100th free clinic in the Philippines, the doctor has never been absent. Although he says he is motivated by Master Zheng Yan's example to keep going, that's another way of saying he is devoted to saving people's lives. It all started in 1995, when the first free clinic in the Philippines was organized.
Diseases actually start as minor complaints, but because local medical care is lacking, they become more and more serious until it's too late to save them. That filled me with regret, so we volunteers resolved to organize a free clinic in the countryside.
Lin Xiaozheng was the Tzu Chi coordinator in the Philippines at the time. After being introduced to Chinese General Hospital Vice Superintendent Liu Xiuquan, the volunteer invited the doctor to lead the first free clinic team. The partnership between Tzu Chi and Chinese General Hospital started in Baguio City in the north of the Philippines in April 1995. A total of 22 doctors and 22 volunteers took part, carrying out operations on 173 patients in extremely difficult conditions.
At the start, the surgery lights were just ordinary light bulbs, but what about the area of surgery? The light was too dim, so doctors very cleverly wrapped newspaper around the bulb to focus the light on the area. We bought bedding, nylon mats for the patients, because after thyroid surgery you have to monitor it for 24 hours, so we gave them mattresses.
Deck chairs were used as beds and school desks were turned into operating tables. Lacking stretchers, the doctors had to carry patients, while nurses followed behind holding IV drips. Even during operations or examinations, volunteers sometimes had to hold up lights and IV drips. At the early clinics, images like these were common. To help people from poor rural areas get the medical attention they needed, volunteers had to organize everything from scratch. Each step, from assessing the site, packing equipment, to assembling machinery, was a major task in itself. At the second free clinic in September 1995, apart from surgery, an internal medicine service was added, and the number of patients increased from 173 at the first clinic to 901 people. To meet the needs of poor villagers, at the fourth clinic in March 1996, dental treatment was included. And at the fifth free clinic in August of the same year, eye checks were offered. At the seventh free clinic in January 1997, apart from surgically removing thyroid tumors, hernias and other growths, plastic surgery was given to cleft lip and palate sufferers. As the free clinic medical team offered more complete services, the number of patients likewise increased. The 18th free clinic in July 1999 broke through the 7,000 patient mark as 7,131 people came for treatment. Both in terms of the medical professionals and the technical equipment, the free clinic team was becoming more accomplished, like a mobile hospital that spanned from the Batan's Island in the northern tip of the country to General Santos City, 1,631 kilometers to the south. Then in 2001, to implement Tzu Chi's community outreach program, Tima Philippines refocused its efforts on Metro Manila. After 2 years of planning, a free clinic center opened in November 2006. And 8 months later, in July 2007, official certification from the Ministry of Health was issued, allowing the clinic to carry out operations in the same way as a hospital. In August of this year, the 100th free clinic took place. It was a moving moment for Dr. Liu Xiuquan, who, although now confined to a wheelchair, insisted on coming to the location to witness the historical occasion with his own eyes. Organising 100 clinics has been a long and hard road to take, but one that had to be followed. Recalling what it was like in the early days, Lin Xiaozheng says conditions were unimaginable, but the simple desire of Tzu Chi volunteers to help has brought relief to tens of thousands of people.
Along this path, I think we're sincerely thankful to heaven and earth. In remote areas, healthcare facilities were bad. If there was an emergency, there was no way to get a blood bag. Thinking back now, it scares me, but at the time I wasn't afraid. I thought it was good then to save people and help people. Like Master Zheng Yan says, with a simple heart, just do it.
By just doing it for 13 years, 100 free clinics have been organised in the Philippines, helping over 180,000 people. Medical professionals have been mobilised in 3,607 individual shifts and 9,352 individual volunteer shifts have been served. But far from sitting back on their laurels, volunteers promise to carry forward their work to bring better medical treatment to the needy wherever they may be.